Palliative care and EDS. I advocate for palliative care for EDS patients. In California, EDS patients were actively being treated with palliative care before the 2014 to 2016 flip. I have a specific example of a palliative care doctor by the name of Solomon Liao, who currently only treats terminal cancer patients, doesn't take EDS patients anymore. But he treated an EDS patient with an inpatient IV ketamine therapy that allowed her to walk for the first time in years. She had been stuck in a wheelchair for years, hadn't walked in years. He treated her as a palliative patient, improved her quality of life, lowered her overall medication intake, and she walked for the first time in years. It is so important to symptom management in patients with EDS. And a lot of times their condition is so far gone because no one believes them, especially women. And they get labeled as med seeking, as being anxiety, as having your stomach pain. It'll just be like constipation. Unfortunately, it could be 10 to 15 years before getting a diagnosis. During that time, you develop secondary diseases, POTS, MCAS, cranial-cervical instability. You need surgeries, Ehlers-Danlos Syndrome. If you're not actively treating the symptoms and getting a care team, you continue to worsen and develop these things. But the reason palliative care is so important is because EDS is genetic and permanent. Getting diagnosed is like, you need time to grieve, need time to process all this. You need an entire team. You need spiritual support. You need therapy support. You need pharmacological support. You need physiological support. You need all this stuff, and palliative care delivers. And by definition, it's not just for hospice. It's not just for terminally ill. It's not just for oncology patients. It is and has been actively used to treat EDS patients for years. Unfortunately, it's really hard to. Women, especially with EDS, are so actively and often dismissed. And this is a huge systemic problem. It was like the opioid epidemic, and they did all these reforms and banned a lot of opioid pharmacological management. Palliative really switched from being just for people who qualify, like EDS patients, to only being for like terminally ill end of life care, especially in California. So let me tell you the story of how this Dr. Solomon Liao treated a patient who had EDS with this ketamine inpatient therapy and allowed her to walk for the first time in years. She stood up out of her wheelchair, a true miracle. Shout out ketamine as like an incredible treatment. This patient was on a ton of morphine. She was on baclofen, gabapentin. She was taking like hundreds of milligrams of morphine a day. On top of the baclofen, gabapentin, tizanidine, duloxetine, and oral ketamine, 40 milligrams, 3 times a day. Despite all of this, she still was struggling with pain. It's called paradoxical. EDS patients can take 4 times the amount of meds. Anesthesia doesn't work as good on them. They need so much more meds than the average person. But ketamine is like a miracle drug for EDS patients. It is neurogenerative, it's neuroprotective, and it does this thing with your NMDA receptors, and it helps retrain your body, and it literally helps you grow like new. It's called neurogenic. It helps with the hypersensitivity. So people with EDS get this hypersensitization, and your nerves get damaged from the constant signals of pain, like always rushing through. But this doctor, there's a lot of literature to support this. Inpatient ketamine therapy, especially accompanied by midazolam. So it's a ketamine and midazolam mix IV treatment. This is what they did. They took the patient in ICU, sedated them. They transitioned them off all of their opiate meds so they didn't withdraw. They started this IV ketamine infusion with midazolam, and they rapidly titrate it. They did it for 5 or 6 days, and then they titrate it down and transition her back onto her opiate medications. And her pain went from a 10 out of 10 to a 3 out of 10 while inpatient. She went on to walk for the first time in years. She started doing IV ketamine twice a week. She only needed half the opiates that she used to take. So it's called paradoxical pharmacological management. So people with EDS, this patient, she was like in her late 20s, like a female who was literally on 300 milligrams of morphine a day on top of muscle relaxers, on top of all this other stuff, and still was in pain. And this is a normal medication regimen for an EDS patient. Oxymorphone, baclofen, gabapentin, duloxetine, montelukast, propranolol, Lorazepam, and then also opioids. Fentanyl has the least histamine response. Oxymorphone and fentanyl with midazolam have the least amount of histamine response for EDS patients, MCAS patients. There's such a stigma because there's literal scientific medical literature to support that is the most effective thing to treat EDS patients through a palliative care doctor. And it sucks in California. It's nationwide. It was a reform that happened as a response to the opioid crisis. More about this in our other videos, but it's called the palliative gap. There's a huge gap now where EDS patients need palliative care and they're not getting it. They used to be getting it and now they don't anymore. There's two literatures. I'll link in the description below literature supporting palliative care for EDS patients. There's two specific pieces of literature supporting it. And also the paper where this patient walked for the first time in years, that was Dr. Solomon Liao. He was a palliative care doctor actively treating EDS patients. So when people say that there isn't a treatment for EDS, they're lying, they're wrong. The literature says otherwise. There's proof of using palliative care to treat EDS patients. There's proof of pharmacological symptom management to treat EDS patients. And there's people out there advocating for these patients, that nurse that published that literature advocating for palliative care for EDS patients. So if you're someone with EDS, you're suffering, I know how bad it is. It's 15 out of 10 pain. You deserve palliative care. If there's anyone ever qualified for palliative care, it's EDS patients. And the literature supports it. It's difficult to find doctors, but they are out there. If you're lucky to find one, bless up. I'm so happy for you. I wish I could give you a list of palliative care doctors taking EDS patients. I don't have that, but it doesn't mean we shouldn't keep advocating and let you know that I see you. I believe in you. All our love.